Hello, dear friends. According to the American Thyroid Association, about 12% of the American population will likely develop a thyroid condition in their lifetime. This translates to more than 20 million Americans experiencing some type of thyroid dysfunction. Unfortunately, about 60% of those with thyroid disorders are unaware of their condition due to the fact that undiagnosed thyroid disease can put one at risk for certain conditions, including cardiovascular disease, osteoporosis, pregnancy complications, and infertility. It's important to be aware of the health of our thyroid. Thankfully, we can nourish our thyroid with our lifestyle practices and by using natural methods such as essential oils to address the triggers that lead to thyroid dysregulation. Due to the importance of an optimized thyroid gland for our health, in today's clinical tip, I want to provide you with some integrative resources to support your thyroid. First, I will discuss some basics about the thyroid gland. Then I will share some highlights from two podcasts on an integrative approach to thyroid health. In an upcoming video, I will take some key takeaways for you to consider regarding caring for your thyroid gland. As always, all the references and links that I mentioned will be available in the resource section. So let's get started. The thyroid gland is a small butterfly-shaped gland located in the middle of the neck. It's an endocrine organ and it produces and releases thyroid hormones. The thyroid impacts almost every other organ system in the body and it interacts with most cellular receptors. Thyroid hormones help to regulate our metabolism, emotions, brain function, heart rate, muscle contraction, and liver processes. Thyroid hormones also affect our physiology by influencing our breathing, digestion, body temperature, brain development, mental activity, skin and bone maintenance, cholesterol levels, and fertility. Now, there are two types of thyroid dysfunction: low functioning thyroid, hypothyroidism, and an overactive thyroid, hyperthyroidism. Autoimmune diseases of the thyroid include Hashimoto's disease and Graves' disease, which can be the cause of hypothyroidism and hyperthyroidism, respectively. Since our thyroid influences everything from our cardiovascular, digestive, nervous, and reproductive systems, and so much more, there are many different symptoms that seem disconnected, but they really are related to someone experiencing a thyroid issue. So some of the common symptoms include changes in body weight, fatigue, mood disturbances, brain fog, anxiety, depression, shifts in metabolism. A lot of times people will be hot or cold, digestive complaints, hair loss, skin issues, sleep problems, and many other things. But besides symptoms, labs can be used to determine the functioning of your thyroid, but there are caveats. Many doctors use thyroid stimulating hormone or TSH to determine thyroid activity. This isn't a direct measurement of the thyroid hormone. Rather, it determines the signaling strength of the pituitary's communication to the thyroid to release thyroid hormones. It's a feedback mechanism. So if the TSH test is not optimal for determining the overall functioning of the thyroid hormone in the body, it is helpful to see if there's a pathology or a disease process. And it is one of the main signals that if the TSH, say, is high and it's trying to stimulate the thyroid and the thyroid hormones are still low, there's probably something going on with the thyroid. But assessment of thyroid hormones and what their levels actually are and how they're converting can be super helpful to see how the thyroid gland is as far as producing output of the thyroid hormone. This includes both free and bound thyroid hormones. So we have thyroxine or T4 and thyroiodothyronine, which is T3. And then you can get the free versions of those as well as thyroid antibodies, TPO and TGAB. There are even more specific, not as commonly used tests for determining thyroid health, and this can be the reverse T3 or the T3 uptake. Your functional and naturopathic doctor will usually screen for many of these lab markers. An integrative doctor will also assess all the interwoven factors and triggers to determine why these labs may be showing signs of thyroid imbalances. Still, it's never wise just to treat thyroid levels with adjusting medications and trying to replace thyroid hormone because it can send other hormones off balance and everything is connected. So, it may be that there are other factors causing thyroid hormones imbalances, and it isn't the thyroid itself, such as in the case of an autoimmune disorder. So, I do have a post that has additional information on labs that you can find in the resource section, and if you want to go into more details about that. Now, as far as resources for now that we know about the thyroid and what some of the symptoms are and what some of the lab markers are, what do we do about it? There are two podcasts I want to point you to that I did previously. One was about essential oils for thyroid health. And on that podcast, I shared how essential oils can support thyroid function. I looked at the various ways that essential oils can support thyroid function by modulating specific thyroid triggers that can cause it to be off balance. We looked at some popular calming and hormone balancing essential oils for addressing thyroid symptoms, how essential oils affect the microbiome and how that influences thyroid health, a list of popular essential oils for common hypothyroid and hyperthyroid symptoms, including pain, inflammation, skin issues, digestive disturbances, detoxification support, and anxiety. Some essential oils that are shown in clinical studies to directly impact hypo and hyperthyroid symptoms in thyroid disease, and how naturopathic and functional medicine doctors can help patients with thyroid imbalances. So you can click the link in the video description to listen to that full episode, and that should provide you with some tools as far as using essential oils for thyroid health. The second podcast I did was a must listen to if you are concerned about your thyroid at all. I did an episode with Dr. Nicholas Hedberg on the essential oil revolution, and he is an internationally esteemed, evidence based, research oriented, and holistic functional medicine and chiropractic physician. He has over 20 years of clinical experience. He's a lecturer, a presenter, a formulator, an author, an educator, and a podcast host himself. Dr. Hedberg actually excels at helping his patients and practitioners that he mentors to find the underlying causes of thyroid disorders and other complex diseases. He then masterfully corrects these imbalances through his explicit and detailed understanding of nutrition, lifestyle, natural hormones, herbal medicine, and proper supplementation. During the show with Dr. Hedberg, he reviewed his functional and integrative approach to thyroid health. He highlighted all the interwoven and intricate connections between the thyroid and our overall wellness. He also touched upon underlying causes of thyroid diseases that are often overlooked and unknown. These include things such as infections, dietary factors, nutrient deficiencies, genetics, detoxification, and more. Finally, we discussed Dr. Hedberg's approach to healing the thyroid and how essential oils play a role. Now, some of the topics that I wanted to highlight for you that we discussed is the consequences of undiagnosed thyroid diseases and what that can lead to. I kind of talked about that a little bit in the beginning as far as diseases it's linked to. The number one symptom of thyroid disease and other accompanying signs, the link between the thyroid hormone and energy production in the mitochondria, the many factors that negatively affect the thyroid, the gut thyroid axis, how to evaluate the cause of fatigue in thyroid patients, the three factors that contribute to an autoimmune disease, such as Hashimoto's disease of the thyroid, the two most important minerals for thyroid function, how hormones impact the thyroid gland, and other common triggers of thyroid disruption, such as chemicals, gluten, infections, isolation, poor adrenal function, stress, and lifestyle. So you'll definitely want to tune in to arm yourself with this information. Now, what I'm going to do is next week come back with some clinical key takeaways from these two podcasts. So it will wrap everything up, and that'll give you some time to listen to it and inform yourself about thyroid health if you want to learn more. You can also just come back for the clinical key takeaways now that you have an overview of thyroid health. But I think that you're really going to want to listen to this podcast and is the one on essential oils to make sure that you are aware of the many different factors that impact your thyroid. So thank you so much for listening today about the health of your thyroid. I hope you find this information helpful for optimizing your thyroid and hormone health. And if you could, I would love for you to subscribe, comment, or leave a review in the section for the YouTube video as well as in the blog. And I will be back again real soon. Take gentle care till then.